Today we will demonstrate the proper surgical skin preparation for cesarean birth using Chloraprep. Proper technique in preparation may reduce the incidence of surgical site infections. We will also discuss preoperative considerations and paniculus retraction. Skin preparation in the preoperative location include hair removal and sage cloths. During the preoperative phase of care, inspect the perineum for hair. The mons pubis is included in the surgical preparation area. Therefore, hair should be removed from the mons pubis prior to surgery. If hair becomes wet with Chloraprep, it can take up to 1 hour to dry, thus increasing the risk for fire in the operating room. If hair removal is necessary, use a single-use electric clipper in a location outside of the operating room. Hair should never be removed with a razor because this can cause abrasions and cuts, increasing the risk of a surgical site infection. Be careful to ensure skin remains intact. Hold clipper at a 45-degree angle to the skin. Glide the clipper along the surface of the skin going against the direction of hair growth. Avoid raking the clipper as this will increase the chance for abrasions. Use tape to ensure all residual hair particles are removed from patient. If the patient arrives for surgery with hair already removed from their mons pubis, the nurse must document in the comments the date and indicating hair was removed by patient prior to arrival. Use both sage cloths to prepare the surgical site and surrounding skin. Start at the incision site and move outward, ensuring coverage of entire abdomen. Also wipe the upper thighs and groin areas. Skin preparation in the operating room includes the application of a traxi retractor and Chloraprep. Assess for presence of a paniculus in upright position before transfer to the operating room. Discuss patient's need for use of traxi retractor with provider as part of the brief. The brief should be conducted before transferring the patient to the operating room. Indications may include patients with BMI of 30 or greater, or situations where the paniculus covers the incisional site when the patient is positioned for surgery. The traxi retractor should be applied before Chloraprep. When prepping the abdomen for a cesarean birth, place surgical towels using sterile technique under each side of the abdomen and in between legs to absorb excess solution. Open both Chloraprep packages and place on the designated prep stand, then don your sterile gloves. Hold the applicator with the sponge down. Do not touch the sponge. Pinch the lever only once to activate the ampule and release the antiseptic. Allow the solution to partially load in the sponge. Press the first cotton swab against the sponge and clean the umbilicus. Then discard. Repeat the step with the second cotton swab, and then discard that swab. Gently press the applicator against the treatment area to evenly distribute the solution throughout the sponge. Once the solution is visible on the skin, completely wet the incision site on the lower abdomen with antiseptic using gentle repeated back and forth strokes. Scrub the incisional site for 30 seconds or 2 minutes if the surgical site is in the fold of the pannus. Progress from the incision to above the fundus, ensuring to include the entire abdomen. If paniculus is present and covers the incisional site when the patient is sitting or standing, scrub the incision site for 2 minutes. Even if the paniculus is lifted by the traxi retractor, the longer scrub is required. Take care when scrubbing an area opposite the side you are standing on to avoid contamination with your arm. You may need to move to the other side. Some patients, depending on the surface area, will require 2 applications on the abdomen. Switch applicator if antiseptic solution becomes low or starts drying. 1 Chloraprep applicator covers a 13 by 13 inch area. Starting with a new applicator, scrub at the top of the mons pubis and prep both upper thighs and groins. The last scrub action proceeds downward from the mons pubis toward inner thighs. Then discard the applicator. Allow the solution to completely dry for a minimum of 3 minutes. If any contamination is suspected, start surgical prep over from the beginning. Chloraprep is for external use only. Avoid applying the sponge intravaginally or to the labia, as this can lead to the solution pooling in the genital area. Remove towels using sterile technique, ensuring not to contaminate the prepped area before draping. Let's review some key points about abdominal scrub with Chloraprep. All patients require a minimum of 2 applicators. If a paniculus is present, scrub the incision site for 2 minutes and avoid applying Chloraprep intravaginally or to the labia. Thank you for taking the time to view this video. Applying what you learned here will help decrease the risk of surgical site infections for your patient.